Sometimes the biggest, most important innovations come from the deepest, most personal struggles. And this is one of those stories. It's about a doctor who, after a decade-long battle just for speaking the truth, took all that experience and channeled it into a solution, a piece of technology that could actually help save a healthcare system that's in crisis. So let's dive into how he turned all that adversity into a real chance for change. This right here, it's the absolute bedrock of medical ethics. It's a doctor's number one job: protect your patients no matter what it costs you. And as we're about to see, for one doctor, sticking to this duty came at an absolutely immense personal price, and it really set the stage for an incredible story of resilience. Okay, so our story really kicks off with a doctor's conscience. We're about to meet Dr. Karyali Srivatsa and an initial conflict that would just spiral into this years-long ordeal, all because he decided to speak up. So picture this. It's back in 2003 and 2004, and Dr. Srivatsa does exactly what he swore an oath to do. He raises some really serious concerns about patient care, and that one single act of professional duty, well, that was the spark that ignited a decade of institutional pushback that would completely change the course of his life and his career. So, what actually happens when you blow with a whistle on the very system you're supposed to be a part of? Well, for Dr. Srivatsa, the answer was a brutal personal and professional toll. In this section, we're going to see the grueling price he paid for his integrity. This slide really gets right to the heart of it all. On the left, you've got the claim from the Primary Care Trust, the PCT, telling him he has to stop working because his name supposedly isn't on an official list. But then, look to the right. We have the documented proof, a letter, that his name was on that list. This wasn't just some simple clerical error. It was a roadblock, plain and simple, put directly in his path. And the pressure just kept mounting, as you can see right here in these meeting notes. They document a really clear attempt to control his career. I mean, that line, "should not move to another list without restriction," that's not standard procedure. It strongly suggests there was a coordinated effort to box him in, to limit his ability to work freely, all because he stood up for patient safety. And this wasn't some quick dispute that got resolved. No, this was a war of attrition. Just look at the timeline. It dragged on for years. He raises concerns in 2004, and then boom, a prolonged investigation starts. Proceedings get delayed for months. And then, the final blow in 2013, he's painted as a problem doctor to the General Medical Council. The system, it seems, wasn't protecting the whistleblower, it was protecting itself. And here's the really sad part. His experience is not unique, not by a long shot. Research shows that these investigations take a devastating mental toll. A staggering 91% of doctors who go through this report high levels of stress and anxiety. It's a process designed to break even the strongest people. Okay, so now let's zoom out from this one doctor struggle and look at the much bigger picture. See, Dr. Srivatsa's story didn't happen in a vacuum. It was all unfolding against the backdrop of an entire national healthcare system, the NHS, that is itself under enormous, crushing strain. Let's start with the money. For 2024 to 2025, the projected annual deficit for the NHS is a mind-boggling £6.4 billion. That is a massive financial hole that affects every single part of the care people receive. So, what does that kind of financial pressure actually mean for patients on the ground? Well, it means waiting. The average wait time just to get an appointment with a GP is now about 2 weeks. It's a frustration that millions of us can probably relate to. And when people can't see a GP, they have to turn somewhere else, right? The NHS 111 phone line gets over 20 million calls every single year. It's a huge, flashing sign of a system that is just struggling to keep up with overwhelming demand. But beyond all those immediate pressures, there is a ticking time bomb. This chart, honestly, it shows a terrifying projection. Because of growing resistance to antibiotics, the success rates of everything from safe childbirth to cancer treatments are projected to plummet by 2050. So the takeaway here is that the system isn't just strained, it's facing a truly existential threat. So faced with a system that's broken and this devastating personal experience, what did Dr. Srivatsa do? He built a solution. After being systematically blocked by bureaucracy, he actually taught himself artificial intelligence to create a brand new, impartial front door for healthcare. And this is it, the Prima Kiosk. Think of it as a new, intelligent welcome mat for healthcare.
Thank you for providing Prima kiosks that have helped reduce demand, waiting time, cost, protect patients, and our lives.
It's powered by an AI called Dr. Maya, which is built on 50 years of clinical experience. And its whole purpose? To basically replicate a doctor's reasoning at that very first point of contact. So how does it work? It's actually beautifully simple. The AI uses a color-coded system to triage you. So if you show up with symptoms, it classifies your situation. Red means it's a life-threatening emergency. Call 999. Blue signals a potential infection risk, telling you to see a professional soon. And green and yellow are for less urgent concerns. It's just clear, actionable guidance right when you need it. And the user interface is designed for absolutely everyone. Instead of confusing forms and bureaucratic nonsense, it uses these simple, large, icon-driven buttons. The whole goal is to make sophisticated medical advice accessible, whether you're a tech genius or you've never used a computer in your life. Now, the strategic benefits for a system like the NHS are just huge. It can help reduce the burden that leads to those 2-week waits, it provides round-the-clock access, and crucially, it can help detect serious infections early, which helps address that ticking time bomb of antibiotic resistance. It's a tool that's literally designed to relieve the biggest pressure points in the system. Okay, but what kind of an impact could this really have? Let's get into the projections. We're going to move from the concept to the hard numbers and see the massive, quantifiable impact this solution could have. These financial projections are, well, they're pretty remarkable. Those huge green bars you see, they represent the costs that the NHS avoids. The data suggests an incredible return on investment. Get this, for every £1 spent on the system, it could save the NHS over £8, just by preventing unnecessary visits and getting people to the right care faster. And let's scale that up. Rolling these kiosks out nationwide isn't just a small saving. We are talking about saving the NHS hundreds of millions of pounds every single year. And these are conservative estimates, somewhere between 400 and 700 million annually. That is game-changing money. But this slide, right here, shows the most important number of all. Because it's not about money, it's about people. This chart projects the cumulative number of lives that could be saved through early detection and better triage. By 2050, that number could be approaching 250,000 people. That, right there, is the ultimate measure of success. So let's just pause on that for a second. A single doctor pushed to the absolute brink for just doing his job, channeled that entire experience into creating a system that has the potential to rescue the very service that fought him and, more importantly, to protect countless lives. And it leaves us with a really powerful question to think about. In a world full of struggling healthcare systems, could the most effective solutions come not from the top down, but from those who have actually experienced the system's deepest flaws firsthand? Could technology that's literally born from hardship be the future of our public health?